Yes, there is another type of research you can start doing as a doctor, as a surgeon in private practice. It's not the traditional medical research. This is consumer research that you can start applying straight away. For example, what are the most common questions you get as you do your consultations? What are the things that keep reoccurring, that patients keep asking? Now, you may have formed some sort of a routine answering those questions, yet it's really useful to inspect and maybe to have your notepad ready and make an inventory throughout your week, or maybe do it for a month, of the most frequently asked questions. Now, there's your experience as the specialist, as the doctor, as the surgeon, and then there's the experience at your reception desk. So ask your reception team, ask your practice manager to do the same, to really list those common questions. You'll be surprised how much you can learn from them. It's not just the questions, it's also the assumptions. So that could be a second list of things that patients commonly assume about your niche, about the procedures or the treatment pathways that you offer. Why is that important? Because if you keep educating your patients on that topic, it means there's something there, there's value there. And if there's a lot of false assumptions or misconceptions around your niche, your specialty, well, you can use that to position yourself as an educator. So that's a second thing to put on your list, the false assumptions. Then obviously there's general comments that patients make, what you see they are expecting. These could be misconceptions about the journey. Maybe they rock up and they think you'll do the surgery straight away. Obviously you won't. So there's all these little and also maybe bigger misconceptions that you can tackle and list. Not just about the diagnostic journey, but also about planning treatment or surgery, and then about recovery times and what's involved. The patient contribution, the effort the patient will be asked to make, the discomfort or the pain. So list all these questions and comments and assumptions that patients have and use them as bullet points to start building your content. So you can do internal research to have a stronger foundation to then build the content that patients value, that they are looking for, that they are searching for on Google. In other words, the content that will make you more visible in an online search. So if you don't know where to start, we can help you. Book a free strategy session with us via Zoom, one-on-one, 30 minutes. We'll talk about your business goals. We'll talk about the questions involved from the patient side and how to get started building better online content. I look forward to meeting you very soon.